Welcome to this webinar on anatomy of the spine and common injuries. My name is Trevor Shell from the Occupational Health Clinics Ontario Workers Center today. It's being presented in cooperation with the Ministry of Labor's The Workplaces Initiative. Thank everyone for signing up and joining our first event. We're actually streaming across 9 Canadian provinces, 6 US states, Australia, Ireland, China, England, Malaysia, Switzerland, and Venezuela. Percent of all adults who experience back pain at some point in their lives. 65% of industrial workers report low back pain symptoms during their career. Low back pain is the most frequent cause of activity limitation in individuals under 45 years, and the third leading cause in individuals between age 45 and 64. Healthy back on soft tissue system like muscles, system, spinal cord, be able to function properly. The back itself is divided into a number of regions. The first being the cervical vertebrae. There's 7 of them, and they support the head and the neck. The thoracic vertebrae are large and more rigid from the chest cavity. And very seldom do we ever hear injuries happening in this area. And the reason for that is because of the fact that this area of the spine doesn't really move. It's basically a spot for the ribs to attach to be able to protect our vital organs. Larger vertebrae that carry most of the weight of the upper body. And of course, the sacrum and the coccyx complete the spine. Now, the intervertebral discs are like shock absorbers between the vertebrae. The outer layer is the annulus, made up of overlapping fibers on 45-degree angles. The inner layer is the nucleus, and it's filled with a jelly-like substance. We also have ligaments and muscles that are under controlled movement and support the spine. They're kind of like duct tape in a way. They're tough elastic fibers, the bone to bone, stabilize the vertebrae as one structure, prevent excessive movement. Movement, stabilization, under voluntary control, meaning we tell them to move. We have muscles in our body like the heart that we can't actually control and tell them what to do. We also have to keep the vertebrae aligned. They're short and less powerful, like compared to muscles like the legs. And there's 2 layers, the superficial and the deep. The abdominal muscles help to support the spine, and they stabilize the spine and protect the lower back. Sets that run vertically, versely, obliquely. They're very broad and flat. The spinal cord, protected by within the bone, moves down the entire length of the spine itself, with branches coming off at every level where the intervertebral discs are, to supply nerves throughout the entire body. The biomechanics of the back, it's like a lever system. Fulcrum is in the middle of the lever. The upward force is required to lift the object is equal to the downward pull of the actual object itself. At the back, the fulcrum is actually offset from the middle. To overcome the force of the muscle, which is what our body's exerting, to be equal to the force of the body, so our natural body weight, and the weight of the object. As the horizontal distance increases away from the fulcrum, the amount of muscle force the back has to exert is much larger as well. There are 2 basic types of injuries. The first is the single high-load one-time injury. In this example, it's someone slipping on the floor. So as a result, it's that one-time impact. And what happens is that each tissue has a set tolerance limit. And when that tolerance limit is exceeded by the applied load, the risk of injury increases. The second type of injury, repetition, along force. So in this example, we have iron workers that are bent over all day long, tying together rebar. As a result, we get stretching or elongation of their muscles, and the tissue tolerance begins to decrease. And when their margin of safety is reduced and it crosses over the applied load, we can see an increased risk of injury occurring. This example, it's repetition, whereas we have someone bending down, lifting in a warehouse all day, up, down, it once again fatigues the muscles and makes them more likely to fail. So why is it we don't see a large number of injuries occurring? Well, because we switch our tasks up. We're actually doing something called a working rest, where, for example, with the warehouse worker, where he's lifting up, down as the applied load, he then goes and does some paperwork. That gives his back muscles a chance to rest and recover. So when we talk about a working rest, it's not doing nothing, it's actually doing other tasks to give your body a chance to recover. With respect to spinal movement, we can actually move forward, which is flexion of the spine, compared to extension or backwards. It's also why we see more injuries happening towards the rear of the intervertebral discs, because of the fact we have that larger range of motion towards the front. So when we bend forward inside the intervertebral discs themselves, you can see in this image where the arrows appear that the disc begins to get less thick. And that fluid inside the disc gets pushed towards the rear, exerting strain on those overlapping annular fibers. Actually degenerate over the course of a day. But also, the best way to see an example of this, I guarantee you, by the time you go into your car at the end of the work, you have to readjust your rear view mirror. And you'll be doing this without even being aware of it. The reason for that is gravity. So when we're standing all day long, gravity's pushing down on us. It causes the disc to flatten out. When we sleep at night, gravity's pushing on us as we're laying horizontally, and so the discs get bigger. So we're actually taller first thing in the morning when we get out of bed compared to when we go to bed at night. Now, degeneration itself results from wearing of the discs. Now, the annular rings become brittle and lose strength, especially as we age. As we age, we actually lose water from our body, and as a result, the risk of injury increases because of the fact we've lost that elasticity. The fluid inside the disc begins to exert pressure on the fibrous overlapping annular rings and can cause it to expand into the spinal canal, where the fluid then exerts pressure onto the spinal nerves. Degeneration, basic chemical changes associated with aging causes the disc to weaken without any form of herniation. For disc prolapse, the form position of the disc changes with some slight impingement into the spinal canal. It's also known as a disc bulge or disc protrusion. For disc extrusion, the gel-like nucleus will break through the annular fibers, but remain within the disc itself. For sequestration, the fluid is now being expelled into the spinal canal. So you've probably heard of sciatica before. Well, what that is compression of the sciatic nerve due to the fluid being pushed out, and the sciatic nerve comes off of the spinal cord at around L4, L5, or L5S1, and it's right around there where we get that compression of the sciatic nerve that leads to pain. You'll often see people with sciatic pain, they have their really good days. So on days like that, they may actually be doing more lifting. But there's other days where they're in pain, and so they're less likely to be doing as much bending and lifting. And in that instance, the fluid begins to move back into the disc. Then they start feeling better again, they start bending, and the fluid once again gets pushed out. So can lifting technique make a difference? Yes, it can. And good posture is important. You want to maintain that cervical, thoracic, and lumbar curve to our spine, And strong muscles, such as the back and abdominals, are very important. Now, in this example, you have someone bending over to actually lift up a wheelbarrow. And you can see that the arrow pointing towards the rear of the disc is much larger because of the fact he's now in that bending motion. In the second picture, the back is straight. He's bending with the knees, and the fluid is equally balanced within the disc. This is called balance compression. Now, typically when we think of lifting, we tend to think of this scenario. Keep your back straight, avoid twisting, close to the body, and keep smooth. But some research has shown that this may not be the ideal lifting position after all, and that, different types of techniques are useful under different scenarios. But first, let's examine the theory behind the acronym BACK. Keeping your back straight or neutral maintains that compression, that equal balancing of the fluid. Once we start getting into that bending motion, we start getting tension being exerted within the disc, that fluid gets pushed towards the back. So you want to maintain our natural curves, keep our spine nice and straight to stay in compression. We also want to avoid twisting. Remember I talked about those overlapping fibers on 45-degree angles. But once we start twisting, half of those fibers, depending on the direction we're turning in, begin to straighten out. Automatically, once we turn and twist, our back is only half as strong to maintain normal loading. As a result, we see more injuries happening when someone actually twists when they're lifting. So it's important to pivot or move your feet when doing a lifting task. Important to keep the load close to your body. The way it is from you, the larger effect gravity has. Gravity, of course, increases the weight of the object. By keeping something nice and close, we're reducing the distance and the effect that gravity has to work on it. So our back muscles don't have to work as hard. Smooth, it's often referred to as jerky motions. I often cite the example of the 50-year-old power lifter. How often do you see one? Not very often, because when they're powerlifting, they're exerting extreme amount of pressure within the intervertebral discs that begin to cause the breaking down of the fibers. Lifting itself should be smooth and continuous. The size of the object can also have an effect. When something's larger, it seems to be heavier, and as a result, more difficult to lift. So you want to try and bring things as close to you once again as possible. Plan before every lift. The load close to your body, feet about shoulder width apart. Bend your knees, keep your back straight, tighten your stomach muscles. Maintain normal breathing. Make sure you test the load. No, just because a box looks small doesn't mean that it's not going to put strain on your lower back. I often cite the example of if anyone's ever gone to a bank and picked up a box of coin. It's a small box. Once you lift it, it's extremely heavy because of the metal coin. So it's important to test that so you know how heavy something is before you actually begin to lift it. Because if you start lifting and it's too heavy, it could end up dropping the object or trying to catch it. And as a result, exerting a jerky type motion onto your spine. Make sure you lift with your legs as well. And if you're straining, there's nothing wrong with asking for help. If something's above what you feel you can lift, get help for that. Heavier loads, of course, harder to lift and increase the probability of getting injured. If an object is heavy, use a lifting aid or get another person to help if the load's too heavy or awkward. It's also important to note for inspections, they could be asking you policy or procedure in place. And one example could actually be if anything's above 50 pounds, we have two people perform the lifting task. Location's also very important. Easier to lift items stored between standing knuckle and standing waist height. It's harder though to lift objects from the ground, and lifting above shoulder height can greatly increase the risk of injury as well, because your center of gravity is now thrown off. You want to try to minimize any vertical distance required as a part of a lift. Try and keep it between that standing knuckle and standing elbow height. Now, I mentioned previously about alternate lifting techniques. The first is called the deep squat lift.
There are a number of lifting techniques that can be employed to ensure you keep a straight back when lifting. The first is the deep squat lift. This is used for small, lightweight objects at floor level. You may use one hand to lift an object and use a free hand to push off the thigh. The diagonal lift is used for moderately heavy items on the floor. This lift requires you get down close to the item and protect your back by making your legs do the lifting. Instead of approaching the item straight on, come at it diagonally from one corner. Lower your body down and place one knee on the ground. Gather the item onto your thigh and into your lap. With your back straight and your arms secured around the item, set your core muscles and stand straight up, making sure your head rises before your hips. You need strong legs to lift heavy items using the diagonal lift. If the item is too heavy or your legs too weak, you may lose your balance during the lift. When you approach the item, first lift up one corner to see how heavy it is. If it is too heavy, get help from a partner or a lifting device. The partial squat lift using one hand. This lift is for small light objects with handles located close to knee height. Stand with the object close to your side. Place your feet shoulder width apart. Place one hand on a fixed surface such as a table, stool, or your thigh. Keep your back straight, push your buttocks out, and slowly lower yourself to reach the object's handle. Prepare for the lift and grasp the object, and look forward. For the support as you lift, push down on the fixed surface or your thigh. Lift upwards, following your head and shoulders. Lift by extending your legs with your back straight, your buttocks out, and breathe out as you lift. The tripod lift is used for bulky or awkward items located at floor level. Put one foot next to the object. Keep your back straight, push your buttocks out, and slowly lower yourself down onto one knee. Position the object close to the knee on the ground. Grasp the object firmly with both hands. Slide the object from the knee on the ground to mid-thigh. Keep your head forward, your back straight, and your buttocks out, and lift the object onto the opposite thigh. Put both your forearms under the object with your palms facing upwards, and hug the object to your stomach or chest. Prepare for the lifting by looking forward. Lift upwards, following your head and shoulders. Hold the load close to your body, and lift by extending your legs with your back straight, your buttocks out, and breathing out as you lift. The golfer's lift is appropriate for light objects that can be lifted with one hand. Place the hand near the edge of a fixed surface if possible to support your upper body during the lift. Keep your back straight and raise one leg as you lean down to pick up the object. The weight of your leg will counterbalance the weight of your upper body. Grasp the object firmly. Prepare for the lift. Look forward and keep your leg raised as you start the lift. When lifting, keep your back straight and breathe out.
When carrying a load, you want to minimize carrying whenever possible. Use items such as an aid, dolly, or cart. To use them safely, make sure you push rather than pull a load, remembering that once you start pulling, you're now twisting and looking backwards. So one, you're twisting your spine, unwinding those fibers, and at the same time, you're off balance. You also want to make sure you keep your knees bent and your back straight. Unbalanced loading also increases the risk of injury. Lifting combined with twisting increases the risk for injury. Of course, overreaching also increases the risk. An unbalanced load, you want to try and maybe perhaps put it inside an object so it's equally balanced and not moving. You also want to avoid one-handed carrying because once again, you're in an unbalanced position and it increases stresses on the discs. Poor grip also increases the risk of injury. I often say this is the reason why we have cases of beer with holes in the sides of them. Because you can get your hands in, get a good grip on your case, bring it in nice and close so gravity has less of an effect. When we can't grip something, if there's no handholds for it, something's very slippery, to try and hold a good grip on it, the chance of it actually slipping through our fingers is a lot higher. So as a result, making sure that we have a proper grip will stop an object from perhaps falling. Prolonged standing also has an effect on low back problems. You want to make sure that you have proper cushioned footwear, especially when working on concrete floors. Some examples, well, they have anti-fatigue boots that actually have the anti-fatigue mat itself built into the boot, or something called an ergomate, which is an anti-fatigue mat which straps over your boot. Both of them actually give you the means to move around your workplace. You have that cushion no matter where you go, compared to the standard anti-fatigue mat, which is only for stationary work. It's also really important to make sure you stretch warm up before doing any physical exertions like lifting. I always give the example of putting a rubber band in the freezer overnight. You take that freezer out and begin to yank it really hard, it's going to snap. And your muscles are very similar that way. You wake up in the morning, they're very stiff, and as a result, they're more likely to get injured. But by doing some simple stretching exercises, we're warming them up. We're preparing them for what's coming. Going back to that rubber band, when I took it out of the freezer, if I started moving it very slowly, very gently, it's going to warm up like your muscles. And eventually you'll be able to move it back and forth without it snapping. Sleep positions, we know that the back has its natural curves. And pillows should actually be used to support this while sleeping, especially if you have back problems, so your muscles don't have to. Misalignment can cause your muscles to seize up and cause cramps or sore back or shoulders. Try different sleep or pillow placement positions to find out which one actually works best for you. Stomach sleepers, sleeping down on your face is a natural human instinct. Place a pillow under your hips to take the stress off your lower back. This is actually the one recommended by most chiropractors. Uh, Now, it's suggested to place one or two pillows, depending on the thickness, under your head and neck. Just ensure that your cervical spine is nice, straight, and elongated. And then an extra pillow can actually be placed between your knees to open up your hips and prevent your knees from knocking together or your legs from chafing. Back sleepers, it opens up the lungs, but it's worse for snoring, especially for your partner. So put one pillow under your head and another under the knees to help relieve pressure on the back. Messages, rather than pull a load, try to catch a falling load. You know what? To catch something, you're increasing the risk of injury so greatly. The company can be charged or fined up to $100,000 for severe low back injury. This is due to the fact that there's a replacement worker, your lost time, increased WSIB, and increased benefit charges being applied to them. So a $200 widget, for example, that's falling is not worth $100,000 for your spine. You want to avoid lifts above shoulder height or directly from the ground. Once again, remembering that the ideal lifting height is from standing knuckle to standing elbow height. Not lift and twist. Turn your feet. Don't attempt to lift a load heavier than what you feel you can safely lift. If you feel it's exceeding your ability, there's nothing wrong with getting help or using a cart or dolly. Develop a healthy lifestyle, including exercise. One of the best exercises for people with severe low back problems is actually walking. The day of staying at home and lying on the couch no longer applies when you have a back injury. Getting up, being mobile, getting the blood going to the muscles is the most important factor to actually stimulate healing. It's also important to think before every lift or carrying task. If you have to move something from across the room, for example, have a look beforehand. Are there any hazards that could cause tripping? If so, move them out of the way. You want to design the lifting task to minimize loads on the spine. Use a good lifting technique. Back straight, avoid twisting close to the body and keep smooth, or the alternate lifting techniques that may be more applicable to different situations. Warm up before lifting, and also communicate when lifting with a partner. For example, if myself and Bob were doing a lifting task, and I say, okay, we're going to lift on 3, but Bob thought it was going to be 1, 2, 3, go. I just thought it was going to be 1, 2, 3. I'm standing upright, and Bob's having the weight of the entire load shift over onto him because he wasn't prepared for what was happening. Available resources that can help you with your manual materials handling. See some procedures, misty prevention guidelines. Website is there. Our OCal website also has a variety of tools as well, including fact sheets, occupational health resources, and videos. We also have a wide number of ergonomic tools that can be used to help assist reduce the risk of injuries. Our newsletter, The Lens, feel free to go to the website on it and sign up for it. We also have a YouTube channel that has a wide variety of different videos on there from different events we hold, including where this one will eventually be. Just go on YouTube, browse channels, and type in OCal Clinics. We're also available on social media. We're on Facebook, Instagram, LinkedIn, and Twitter. We also have a number of upcoming webinars over the next couple of months. The first being November 20th, Respiratory Hazards Part 1, followed a week later by Part 2. December 4th is going to be Ergonomics and Snow Removal. So anyone here in the Sudbury area, if you look out your window right now, we're supposed to be getting 20 centimeters of snow, so we probably should have scheduled that a bit earlier. February 28th marks our 21st annual Repetitive Strain Injury Awareness Day from 8:30 to 12:30. And then from 1:30 to 5 on the same day, there's another workshop happening called What's a Worker's Life Worth? And then on March 11th, I'll be back to do computer hotkeys and how to reduce repetitive mouse use. If you have any questions, please contact the OCal clinic nearest you. We've got 7 locations across the province: Hamilton, Thunder Bay, Ottawa, Toronto, Sarnia, Windsor, and Sudbury. Thank you very much for your time.